Hi everyone, welcome back to my YouTube channel, and today we are going to talk about electrocardiogram. So let's start our topic with introduction. An electrocardiogram, that is also called a ECG or EKG, is a diagnostic test that records the electrical activity of the heart over time. It is non-invasive, simple, and widely used tool in the medicine to assess heart rhythm, detect heart disease, and monitor cardiac health. By analyzing the heart's electrical pattern, healthcare providers can identify arrhythmias, ischemia, myocardial infarction, and other cardiac conditions. Definition: ECG or electrocardiogram is defined as a graphical representation of heart's electrical activity that is captured through electrodes placed on the skin. It measures the depolarization and repolarization of atria and ventricles during each heartbeat, producing a waveform that reflects the heart rhythm and function. History of electrocardiogram. First electrocardiogram was recorded by Augustus Weller in 1887 using a capillary electrometer. Modern electrocardiogram development was advanced by William Enthuen in the early 1900s, who introduced the string galvanometer and standardized the P, QRS, and T waves. Enthuen received a Nobel Prize in 1924 for his contribution. Principle of ECG. Heart generates electrical impulses that trigger contraction and relaxation of atria and ventricles. An ECG captures these electrical currents using electrodes placed on limbs and chest. The main principles include depolarization, that is electrical activation of cardiac muscle leading to contraction, repolarization, that is recovery phase when the heart muscle resets electrically, and electrode placement that detects voltage differences across the body to produce a waveform. Components of ECG. Each waveform represents a specific cardiac electrical event that include P wave, PR interval, QRS complex, ST segment, T wave, QT interval. Now let's talk about these components one by one. First component of ECG is P wave that represents atrial depolarization. It is small upward deflection. Its normal duration is 0.08 second to zero point 0.1 seconds. Second component of PCG is PR interval, as you can see in the diagram. It is time from beginning of atrial depolarization to ventricular depolarization. Its duration is about 1.12 seconds to 0.20 seconds. It reflects AV node conduction. Third component of ECG is QRS complex. It represents ventricular depolarization. Its duration is about 0.06 seconds to zero point 0.10 seconds. It includes Q wave, that is initial downward deflection, R wave, that is upward deflection, and S wave, that is downward deflection following R. Next component of ECG is ST segment, that is period between ventricular depolarization and repolarization. It is normally isoelectric and that's why it appears flat. Elevation or depression in this area indicate ischemia or infarction. Fifth component of ECG is T wave that represents ventricular depolarization. It is normally upright in most leads. Sixth component is Q or QT interval, that is time from ventricular depolarization to repolarization. Its duration varies with heart rate. Normal duration is 0.36 seconds to 0.44 seconds. Types of ECG. First is resting ECG, that is standard 10 lead recording at the rest. Second type of ECG is exercise or stress ECG that monitor heart function under physical stress. Third is Holter monitoring, that is ECG that continue 24 to 48 hours recording for detecting intermittent arrhythmias. Fourth is event recorder, that is patient activated devices for recording rare events. And fifth type is telemetry, that is continuous monitoring in the hospitals. Indications of ECG. ECG is used in clinical diagnosis and monitoring of arrhythmias that include atrial fibrillation and ventricular tachycardia. Ischemic heart disease that include angina, myocardial infarction. And also diagnosis and monitoring of heart block or conduction abnormalities. in electrolyte disturbances like hyperkalemia and hypokalemia and structural heart disease, and also to monitor response to medications and preoperative assessment of patient. Procedure of ECG. First we do is preparation, in which patient rests in supine position. Skin is cleaned to reduce resistance and electrodes are attached to standard position on limbs and chest. Second we do is recording, as leads record electrical activity from different angles. Standard 12 lead ECG include 3 limb leads, 3 augmented limb leads, and 6 precordial leads. Recording usually takes a few minutes. Interpretation of ECG. ECG interpretation involves analyzing heart rate and rhythm, axis of heart, intervals and duration like PR interval, QRS interval, and QT interval, waveform abnormalities, ST segment changes including ischemia or infarction, and presence of arrhythmias or conduction block. Advantages of ECG. First, it is non-invasive and painless procedure. Second, it is quick and cost-effective procedure. Third, it provides valuable information about heart rhythm, conduction, and ischemia. Fourth, it is useful for diagnosis, monitoring, and prognosis. Limitations of ECG. It cannot directly measure heart function as it needs echocardiogram for structure. It only captures electrical activity at the time of recording. Third limitation is intermittent arrhythmias may be missed without prolonged monitoring. And fourth limitation is it requires trained personnel for accurate interpretation. Conclusion of this lecture video. Electrocardiography is an essential diagnostic tool in cardiology that provides rapid, accurate, and non-invasive assessment of heart's electrical activity. It is invaluable in diagnosing arrhythmias, myocardial ischemia, electrolyte disturbances, and conduction abnormalities. Early use of ECG in patients with cardiac symptoms can guide treatment, prevent complications, and improve outcome. Its simplicity, accessibility, and diagnostic value make it a cornerstone of modern cardiovascular care. And this was all about ECG. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.